on to Indiana University Med School, and of course he becomes an ophthalmologist. I know something about ophthalmology because of my eyes. We don't need to talk about that. But then he finds his journey a place called Oregon, at the Oregon Health Science University, where he does his residency. I don't know if he ever would have ended up here if he hadn't gotten that residency, but I'm grateful that he did get it. Of course, he would be an outstanding member of the faculty, an outstanding surgeon. And lo and behold, he becomes the dean of the Oregon Health Science University School of Medicine in 2003. I moved a little fast. I want you to understand, he has a son. They have a son, CJ. I had not met him, but he has degrees from the University of Oregon, and of course, he has his master's degree from San Diego State. I believe he lives in the San Diego area. His late daughter would go to Dartmouth, and Katie, and I only say that because my older brother went to Dartmouth, has 2 degrees, and plays baseball. I wanted to go to Dartmouth, but I didn't want to go where my brother went, but it wouldn't have mattered because, like Yale, I couldn't have gotten in. But I have tremendous affection. I think Dartmouth is my most favorite of all the Ivy League schools. But it doesn't matter because, as they say, I couldn't get there. So that's something else I find very sentimental about the good doctor in terms of his connections with me that he may not have known about. He is an interesting person because I don't think you could usually do what he did. So he's dean of this medical school, but then he becomes the president of Oregon Health Science University in 2006. Now, I think that's significant because that means, because they're going to hire somebody, I'm getting the fact he is retiring when I'll comment on that, how much I'm not happy about that. But what I think is interesting, they're going to get somebody from outside. He's homegrown. And I don't think there's anything wrong with being homegrown. I think there's sometimes a theory you got to get somebody from the outside to be successful, but he's homegrown. He becomes there, his residency's there. He's on the faculty there. He's a surgeon there, the med school, and then the president. That story I really, really like. The only thing is he's not a native Oregonian, but I'm sure if he could be, he'd like to be, although he loves the state of Indiana. Now, Oregon Health Science University is an institution I know something about. It's been a week in that place in December, and we won't go into why I was there for a week, but I've spent time there. But one of the things I'm really amazed about there, and he had so much to do with this, they treat over 500,000 patients a year. Over 50% of these patients are outside the Portland metropolitan area. And when my visits to see my doctors and surgeons there, I'm always amazed to get talking to people. Your Klamath Falls, your Ontarios, your Lakeviews, they're there. So this place serves all of Oregon, my Oregon. And that has a lot to do with his background. He started this program involving individuals that if they were willing to serve in underserved parts of Oregon, they would get free tuition, or we would pay their tuition. Now, the legislature had a lot to do with that too. But that very much relates to his background and his sensitivity, true sensitivity to rural Oregon, to small town Oregons, and making sure those people have as much access to medical facilities as those of us that live in the urban areas. Because you can hurt a long time before you can see a doctor if you live in these small towns out there, a long time. And I think they have a special place in his great heart. Just a few things, and I asked for these figures. This is it's the #1 hospital in Oregon. It's #2 in the nation for family medicine education programs. #4 in the nation for rural medicine education programs. #5 physician assistant program in the nation. It's the top 20 in the nation research institutions. And I could go on and on. This is not a lightweight institution on the hill just north of here. And while I know he would never claim he had much to do with that, he really has set the tone for some 10 years. I've had the real honor and pleasure to meet his wife, Patricia, who I don't think is here today, really wanted to come, but I think her mother has recently fallen and she needed to be with her mother. You got to understand the good doctor. He and his wife are total, I've seen them together. They're a team. They're just a team. This man, he relies on her, they're just special. So I really am sorry Patricia can't be here. I really hope she understands that we wish she could be here. He's got a few cute things in his background. I'm going to do this, and then I'm going to say something personal about him. He loves the outdoors. He lives in a houseboat. Now, anybody who lives in a houseboat I find peculiar, but I love it because I love water. And I've had the opportunity to be in his houseboat. And it is something else. It is an extraordinary place. He is an Eagle Scout. Now, there's one other Eagle Scout on this floor. I have very strong feelings about Eagle Scouts since, I won't say I was thrown out of the Boy Scouts, but they were happy when I left. I've only known several Eagle Scouts in my life, the late Vic Atiyeh, Chris Edwards, and of course Senator Mark Hass is an Eagle Scout. He doesn't look like an Eagle Scout, but I don't want to say that, whereas those that I mentioned look like Eagle Scouts. So I don't quite understand how this happened, but that is a very high honor to be able to achieve that kind of recognition in scouting, is to be the Eagle Scout. You are the supreme of the supreme. In a high school golf tournament, he beat Fuzzy Zeller. He later went on to win both the Masters and U.S. Open. I've already told you he played basketball at Yale. On a personal note, he had a little medical news come to him recently, and I won't go into it, but he told me, I'm okay, I can do the job. And then he would call me a few weeks later to say, Peter, I think I'm going to retire. Now, I'm just going to say, he's only been the president for 10 years. For many presidents, that's far too long. This man, he's just getting started. And I was hoping we'd have him at least another 10 or more. But that's not the case. And I have to say, when the press asked me about him, I said, I hope he'll stay on the faculty, or he'll stay somewhere around medicine in Oregon, wherever. I hope he won't leave us. I hope he won't really retire. And that's a very selfish statement to make. Because we as citizens, our medical, how are you going to describe health care in this state? You can't describe it very long without mentioning Dr. Joe Robertson. You can't. And a lot of people don't know that, but if you have any situation where you have to go to that place on the Hill, and I hope none of you ever do, you'll begin to realize the magnitude of the expertise, the patient care, the attitude of that place. And there's a movie, and I'm not going to bore you with my movies, but there's a line in it, attitude is a reflection of leadership, Captain. Attitude is a reflection of leadership, Captain. It was a football movie. And there is a very good attitude on that Hill. A very good can-do attitude, caring attitude in that Hill. It starts with this man sitting at my desk, Dr. Joe Robertson. So I can't tell Senator Jenny Burdick, I'm not supposed to name her, how happy I was when she came to me and said, Peter, would you do this? I don't know why she asked me, but she did. So this is a special resolution. He's here. I wish his wife could be here. And I hope he takes to heart that I hope he doesn't go far from us and medicine or the institution on the Hill. So thank you for letting me say all those words. He's going to get a lot of green. He deserves a lot of green. And I thank my fellow senators for allowing this moment to recognize an extraordinary Oregonian for all of Oregon's people.
Senator